It's not just a coronavirus right now. We're having what you can read the news. There's 3 different viruses circulating right now: the coronavirus, the flu, and RSV, and all of those are influencing all of us in the context. They're all respiratory viruses, and all can cause some sort of pathology, whether it's a cold-like symptom, more serious, and obviously we're seeing hospitalizations.
Part of why we're seeing more activity now of flu and RSV, more people getting sick and more severe illness, is because for the past 2 years, many people have not been exposed to those viruses. And so our immunity to those viruses has waned. There are a lot of toddlers and infants who've never been exposed, so they are susceptible. And also pregnant moms, the mothers of those babies, haven't also seen RSV and flu, and by direct extension passed that immunity on to their babies.
So the current vaccine, the booster we're seeing, the bivalent that's been called, or that is what it's termed, is specific for this Omicron variant. So where it's different from the previous vaccine, that was based on the original virus that came out, almost 2 years ago, or more than 2 years ago now. And so the bivalent has now been done specifically to the current strain. So it's a great match. It's very, very effective.
So the flu vaccine each year is formulated based on what strains are circulating in the southern hemisphere winter, particularly early on. They need about 9 months to prepare the vaccine once they decide on the particular strains. So it does take quite a while, and that's really an educated choice of which strains will be circulating.
It's always important to get vaccinated, and if you really think back to the history of vaccinations, it's really along with, so vaccinations and sanitation have really been probably, and we can add in antibiotics as a third, the greatest improvement to human health.
Vaccines reduce risk, just like car seats reduce risk of babies getting hurt in a car, just like seat belts help reduce risk of any of us getting hurt in a car accident, car crash. So vaccines are important to reduce risk.
The flu vaccine we're taking this year is a very good match with the current circulating strain. So again, recommend everyone get vaccinated for the flu.
Most of this is just common sense, and if you're sick, you should stay home. And we've been up and down on whether to wear masks or not. Masks work. Masks prevent you from spreading illness to other people, prevent other people from spreading illness to you, and the data is very clear on that. And so if you want to reduce your own risk, either from spreading or contracting illness, then wear a mask, especially in high-risk environments like grocery stores, concerts, big gatherings, church, and the like. And then also maintaining some social distance, physical distance, we should say, not social distance, and because that distance around us also is a barrier to the spread of viruses. And then vaccination, another good risk reduction strategy.
Please, go get vaccinated, trust the science, and protect yourself and your family.